In this presentation, we're talking about self-care and where that can be um, specific and a little bit different for older adults. My goal with this presentation is to help you understand the importance of self-care, to identify different ways to take care of yourself, to understand the uniqueness of self-care among older adults, and to create an action plan to engage in regular self-care. So, self-care in the mainstream, what comes to mind when somebody says self-care? Just take a second to think about what comes up for you. For many, there comes up ideas of treating yourself, like a treat yourself mentality, of glamorized ideas, often feminized, and sometimes thought of as an excuse to not get things done. So there's the whole concept of spa days and treating yourself to dessert, but self-care is so much more than that and actually rooted in very different, wholesome, critical practices. So what self-care actually is the activities that one takes with the intention of enhancing health, preventing disease, limiting illness, and restoring health. This definition came from the World Health Organization in 1983, and more recently, there is the definition from LeBlanc in 2017 of self-care as an emotional process that includes attitude, intention, and self-determined choice. So self-care is both reactive, being concerned with the management of symptoms associated with existing acute and chronic health conditions, and proactive, being focused on the prevention of illness through healthy lifestyle. It's necessary across the lifespan, not just for any one group of people, but necessary for all people in order to do things that you want to do. The image on the right highlights the construct of burnout. Burnout is something that happens when we just keep going without stopping to rest and revive. It's not sustainable. At some point, we break, whether that be lashing out, suddenly feeling anxious or overwhelmed, the panic attack, or unable to continue the work that you want to be able to do. Work referring to whatever it is that is meaningful to you that you do. Self-care is intervening before the last match that burns out and breaks. The sooner, the more proactive, the better. The sooner, the more proactive. The later, the more restorative. Audre Lorde is a very, very important figure in the promotion of self-care. She's a historical figure in this self-care movement of caring for oneself in order to make big changes. So her quote being, "Caring for myself is not self-indulgence, it's self-preservation, and that is an act of political warfare." So self-care is identifying and meeting your needs. It's not a guilty pleasure, it's an important part of wellness. It's a preventative measure that can help you overcome stresses of life. Without it, we can't give as much of ourselves to our audience, our customers, our clients, our family, and the people we care about. So think about when you're on a plane and the flight attendants are going over what to do if oxygen masks were to become necessary. The instructions are to secure your own mask before helping others. If you don't secure your own oxygen mask first, your effectiveness in helping others is severely compromised, and failure is eventually inevitable. It only costs a few seconds, but it has benefits that stretch far beyond that. However, for many people, it's not their first instinct. Their initial response may very well be to protect others, especially if loved ones are involved. And you do anything to make sure that they're safe before you think about turning back to yourself. It's natural for many of us, but it's not necessarily effective, particularly in the long run. We have an energy bar that gets eaten at bit by bit every day. Different activities, different people take different amounts of that bar. Unless you consciously decide to restore it, it's only heading downwards. So self-care has an interesting history. So in the late 60s and 70s, academics started to look for ways for field workers and those in high risk and emotionally vulnerable, emotionally demanding positions and professions like trauma therapists and social workers to help deal with the intense stress that's brought on by their job. So there were also activists in the civil rights movement and women's movement who talked about self-care as a radical political act, much like Audre Lorde, as a vital way to counter the treatment that they were receiving in the mainstream medical system in a way to empower themselves. In the late 1970s, self-care was kind of dominated in the concept of a little bit more in activist groups, including lifestyle-based hippie and new age movements. So one of the key words there were wellness and self-care, portrayed like quirky, cult-like trends. Then everything changed after 9/11. The media and academics started to have bigger conversations around the role of self-care, specifically after this traumatic event occurring on 9/11, as well as other traumatic events that occurred then on out. At this point in time, blogging and online media also became more available, which allowed marginalized voices to discuss this area of do-it-yourself self-care, which started to gain more attention, and identity politics started to emerge and become more available to people. And now, we certainly see self-care as a marketing tactic, but we do also see the science of it that supports and defends the origin of self-care, being that fixing your own oxygen mask before helping others. So despite the profound use of the term self-care in media and advertisements, we do now know that self-care is literally taking care of yourself for the purpose of healing yourself so that you can do your work in the world. The race is long, so why not come back refreshed? Self-care can help older adults become competent participants and managers of their own health conditions. It can help them stay in their own homes, for example. Self-care is especially important. It is important for all, but for older adults, it does have some of these unique components to it. So it can also increase management and treatment of various diseases, reducing physical symptoms and suffering. This continuation of independence is really important. So aside from managing their own health conditions, self-care can also help older adults maintain their own ability for decision-making and autonomy. There's also maintained improved physical, mental, social, and spiritual well-being and independence. A maintained or enhanced self-confidence, perceived bodily and mental well-being, or mastery of ability in daily life. There's also improvements of quality of life and decreased use of formal healthcare, which lead to decreased costs of healthcare. So there's a number of areas within self-care. One being physical self-care, in which examples include getting proper and sufficient sleep and nutrition, nourishment, engaging in exercise, moving your body, and regular healthcare visits. So considering this area, think about how well do you take care of yourself physically? Think about ways that you can engage in physical self-care to take care of your body. There's also emotional self-care. So examples of this might include maintaining professional and personal support systems, engaging in counseling or therapy as is needed, journaling and or talking about feelings in a healthy way. So in this area, think about how you take care of yourself emotionally. In the cognitive realm, cognitive self-care might include things like reading for pleasure, writing, and engaging in continued education to learn more about a specific area or learn a new skill. So think about how you're taking care of yourself psychologically. In the social realm, social self-care, examples might include spending time with friends, family, or colleagues that you enjoy, having fun, belonging to groups, communities, and activities that encourage positive social connections. Think about how you take care of yourself socially. Financial self-care too. This includes balancing a checking account, planning for the future, spending money in a thoughtful and productive way. Think about how you take care of yourself financially. And lastly, spiritual self-care. Examples might include prayer, meditation, connecting with nature, connecting with God or a higher power, participating in worship or community, or a 12-step recovery program. Think about how you take care of yourself spiritually. So self-care can also have a unique component for older adults. While the different areas that we just talked about might be applicable to everybody, there's some studies that have looked at what self-care looks like for older adults, what is valued. So one study done with older adults found that older adults talked about very specific things that improved their self-care. So those things being really the common theme was using self-care as a way to keep doing the things that they love doing and promote positive health outcomes. So some of the themes that came up here were focusing on what is within one's control and trying to let go of stressing about things that are beyond one's control. Forgiveness, staying busy, engaging in prayer and having a strong faith, maintaining supportive relationships, and being actively involved in their health. So making an action plan can be a really helpful way to promote self-care for yourself. An action plan is a way to customize a self-care plan as a preventative measure. It helps you take the guesswork out of what to do so that you know in a moment of crisis where to turn. And it helps you stay the course and maintain consistency in self-care practices. So take action and take care of yourself. Reflect on these questions here, whether that just be in your mind or writing this down on a piece of paper. But what steps can you take to take care of yourself? Think about some of the examples that we talked about and some of the different areas in physical well-being, spiritual well-being, emotional well-being, psychological, cognitive well-being, financial well-being. Think of some of these things and ask yourself why it's important to you. Because if you aren't passionate or finding meaning in the goals that you set, it's going to be a lot harder to stick with them. And then in setting these goals, you want to think about how often you're going to engage in these self-care behaviors. You also want to consider barriers or things that might get in the way. So what are some of the possible reasons that you might not stick with your goal? What are your barriers? And what are things you can do to overcome these barriers? And then consider who can help you achieve these goals. Bring someone in to hold you accountable and engage in self-care together. So can you invite a partner, a friend, a child, a neighbor, somebody to join you in these things? So that was briefly a little bit on self-care and self-care in older adulthood. If you have any questions, please feel free to comment or to email us at pacific.memri.clinic@gmail.com. Some of the sources that we use to put together this presentation are listed here.